Hi everyone, I'm Dr. Jenny Lay. I'm a family medicine physician and a mom of two. So the other week I just started a TikTok. I know, I feel ancient on there, but I thought that we can do a TikTok medical reaction video. Are any of these things that they are talking about on TikTok real? Should you listen to these recommendations? I'm gonna let you know. So this is actually true. If you go to the bathroom just in case, your body sends a signal to your brain that, hey, I'm emptying at this point. This is probably when I need to go pee now. And so you keep signaling yourself to go pee earlier and earlier. We do bladder retraining for people who have incontinence issues. And what you do is that when you feel like you need to go, you just stop and you squeeze your pelvic floor muscles and you wait until that sensation goes away and then go to the bathroom fully empty, and then try to extend by 15 minutes every day. So say the first day you have to go to the bathroom every hour. Try to wait for an hour, 15 minutes before you go to the bathroom and slowly extend week after week. And it's normal to hold your bladder for about 3 hours, 3 to 4 hours.
All right, we just found out a new way to crush meds in a syringe. So this is only a 5 ml. Look at this pill, pretty good size. I won't even break it, it's in there, whole. Okay.
Did you show them? Did you put it in there?
I did. That's my mom helping me out with the video. Oh yeah. Look,
Thanks, Mom.
I'm gonna draw it up like,
Oh my gosh, that's so cute.
draw up like 2 cc's. Okay, that big pill and 2 cc's. And then you get the air out. You plug it with your thumb. This is the coolest part. And then you pull back on the plunger and you just let it hit there. And after one little hit, it's already...
Oh my gosh, so I'm gonna actually go try to see if this actually works. Okay, I don't have a 5cc syringe, but I have this 3cc syringe or a 35cc syringe, and I have some extra strength Tylenol here. This is how big the tablet is. Let's see if it'll work in this one first. So, it might be too small and it doesn't have enough pressure. Okay, so I'm going to take the water out. Okay, and then hold it with my finger. No way. Oh my gosh, I can't believe this is working. Okay, let's see. Oh, no. Oh, there's still a little bit in there. Oh, so close. There's still a little bit left in there. Let's see. Not bad. I mean, this is a 3cc syringe, and so I'm sure if I use something like this or the 5cc one, it would totally work. All right, always check with your doctor what the dosage of Tylenol and ibuprofen your kid should take. But this, if your kids can't swallow pills, life-changing. Oh my God. That's so cool. Thanks, TikTok.
3 lab tests you should always ask for at your yearly physical. 1. C-reactive protein. This measures the level of inflammation in your body and can predict your risk of heart disease, stroke, or diabetes.
Okay, let's stop just right there for a second. You do not need a CRP for a wellness exam. A CRP, yes, checks for inflammation, but is very non-specific. So you can have inflammation from exercising. So it's not very conductive to overall health. I would focus more on talking about your lifestyle. How are your periods? Are you pooping normally? How is your sleep? How is your mental health? Are you mentally, physically, and financially secure? Those are the things I personally talk about at the wellness exam. Okay, let's continue.
2. Fasting insulin levels. This indirectly tells you how much your blood sugar fluctuates and can speak volumes about your risk of heart disease, diabetes, and even some cancers.
I'm not sure what he means by fasting insulin levels. It could possibly mean fasting glucose level, which is a fasting sugar level. If your fasting sugar level is high, it may indicate that you have diabetes or early signs of pre-diabetes. It does create risk of like heart attacks, strokes, and things like that. I'm not sure how you check for insulin itself.
3. A lipid panel. This measures the different types of cholesterol in your body. Pay special attention to your triglycerides and HDL level, as these are the best predictors of heart disease.
Okay, so we do check a lipid panel, and the American Academy of Pediatrics does recommend checking fasting lipids at least once from ages 9 to 11, I believe, because in those instances you can catch familial hypercholesterolemia, which is just high cholesterol that is genetic in your family. So you do that once, and then if your cholesterol is normal, you don't likely need to check it every year. You can check it like every 3 years or so, unless you have significant changes in your weight or your diet or your lifestyle. And the things that you should actually look out for is the LDL level, because it is directly correlated to increased risk in cardiovascular disease, heart attacks, strokes, and things like that. The HDL is your good cholesterol, and you want that to actually be high. And in order to do that is increasing physical activity and exercise. To lower LDL, you need to increase fiber, fruits, vegetables in your diet, and decrease red meats and animal products such as like cheeses. Oh my gosh. Okay, so that is a pretty big boil there, and this person had burned themselves. What you're actually supposed to do for something like that, preferably from a medical professional, but I know not everyone has access to healthcare, so I like to put this information out there, that with a sterile needle of some sort, you're supposed to poke it and drain it, but leave this top part on. It acts as a barrier protection for your skin underneath. Okay, once it's really big like that, you should really pop it to drain it so that you can relieve some of the pressure. Remember, it has to be sterile. And then if you burn yourself, it is better to run your finger or what the burn spot under cool water, but not cold, cool water, so that it will stop the burning process. It's kind of like when you're cooking steak and you want to take the steak off the pan to let it cool. The steak is still actually cooking because it's hot. And so running it under that cool water will stop that cooking process. You don't want to run it under cold water or put ice on it because it causes vasoconstriction of your vessels that prevents blood from coming to the area to help support the tissues from dying. I know, nuances. So this girl is undergoing a sleep study. So you have to put all these electrodes on you, and they monitor your sleep to see how much you're in REM sleep. If you have sleep apnea, they check your oxygen levels. So usually when a patient comes in and I ask them about snoring, and if they snore at night, if they wake up feeling unrested, or they're really tired, or if anyone's ever told them that they stop breathing in the middle of the night, if any of those answers are yes, then I send them for a sleep study. And it's really important to diagnose this and treat this, because if it goes undiagnosed, you're not breathing in the middle of the night, you're not getting oxygen to your tissues. It elevates your blood pressure, it can cause weight gain, it could cause depression, fatigue, and really affect your daily life. Usually for kids, and she looks very slender, most of the time you can just remove your tonsils and adenoids, and that can prevent the sleep apnea. In other cases, people need a CPAP machine.
Eating disorders are a joke, they said. Well, then why is my blood pressure still playing games with me? Oh. After a relapse I had a month ago, and now I'm chilling. And now I might have to go to the hospital because my blood pressure's so low. You know, this ain't no joke no more. Stop playing. Yeah.
So what she's talking about here specifically, the eating disorder, is usually anorexia nervosa. And that is when your BMI falls below 17 and you are unable or unwilling to get your BMI up above that due to fear, body dysmorphia. Anorexia nervosa is linked to one of the highest morbidity and mortality in any of the eating disorders. Your body needs about 1,200 calories a day just to exist, just to survive, just for you to breathe, your heart to beat, your intestines to digest food. So if you're not eating at least 1,200 calories a day, your body starts shutting down. And some of the things that start shutting down is your heart, regulation of your blood pressure. And so I've had patients at Seattle Children's, where I worked at, where their heart rate would just dip into the 40s at night because it's the way for the body to conserve energy. And so it is really sad and a really serious deal. Eating disorders is not a joke, and we should support the people around us as much as we can.
I'm a certified hormone specialist, and here are 3 things you can do to have happy hormones.
Okay, hold up right there. Hormone specialists. The only hormone specialists I know are endocrinologists who went to medical school and went to specific endocrinology training. And 2, what hormones are you talking about? Because there's lots of different types of hormones. There's cortisol, there is, adrenaline, there's thyroid, there's your FSH, LH, testosterone. There's so many different types of hormones. So you can't just use a catch-all phrase and say that these things are going to help. I don't even know what she's going to recommend yet, but how do you know? Like, everything is so different. This frustrates me.
It's been shown through numerous studies that coffee on an empty stomach raises cortisol so high. It messes with your blood sugar. It's going to cause instant crashes. I'm not saying no coffee. I'm just...
No. What studies? What studies? Why? Okay, I can't even watch the rest of this. Why? Don't listen to anybody who says they're a hormone specialist that are not endocrinologists. It's all fake, not backed by evidence-based medicine, trying to sell you something, trying to fearmonger. I do not agree.
I'm a licensed counselor, and these are 4 substances you probably had no idea give you terrible withdrawals, and I bet you're using at least one of them. Number 4, everyone's favorite, caffeine. Most people don't know when you stop you can have horrible withdrawals because, frankly, most of us just don't stop. Most notably, you can have severe headaches, fatigue, irritability, and muscle tremors, all of these lasting up to 9 days. Not today.
Yes, that's true. Some people who stop drinking coffee have really severe headaches. I get kind of like a brain fog where I feel like I'm not fully awake. Some irritability, maybe.
Number 4, this has got to be the weirdest one, Afronasal spray. Yes, this stuff works so good because it mimics adrenaline and pries your nostrils right open when you're stuffed up. The only problem is that when it wears off, you're worse off than you were before, creating a cycle of dependence where you have to use more and more to even breathe. Yes, freaking nasal spray.
Yes, oh my gosh, when I was, again, at Seattle Children's, I had this really, really bad allergies. They put me in a hotel room that was not very clean, and I had really bad congestion. And so I used the Afronasal spray. You're only supposed to use it for 3 days max. Any more than that, you can get rebound congestion. Why that happens is because when you use the Afrin, it causes vasoconstriction in the vessels of your nose, which enables you to breathe. But after the Afrin wears off, about 12 hours, you get dilation again. And so that's why you get the rebound congestion. It was bad. I felt like it was a gateway drug because I was like, I need my Afrin. And I was like sniffing it every 12 hours. It's like literally 12 hours on the dot. And so in order to get rid of that, you just have to stop using it and be congested for about a week afterwards, and then it would go away. And so if you want a better alternative for congestion and allergies, I did a TikTok video on how to clear your nostrils. You can also use a nasal steroid like Flonase. That it takes a little bit longer, and so if you know the season is coming up, you should just do it as preventative. All right, that is all I have for this video today. I hope you guys enjoyed. If you haven't already, follow me over on TikTok, subscribe here to this channel, give this video a thumbs up because it really helps us out, and let us know what you want to see in the comment section below, and I'll see you guys next week. Peace.